Hello, my name is Jerry Nwobodo. I'm the co-founder of Presibo. Presibo is a healthcare solution. We're trying to create access to continuous healthcare, to remote monitoring and chronic disease management across Nigeria and Africa using our AI tools and our advanced technology to bridge the gap in patient-doctor access in Africa through technology. We are creating a platform where we can help Nigerians and indeed Africans get access to medical services, get access to healthcare professionals, and get access to continuous healthcare, remote monitoring, and chronic disease management through our platform. The inspiration for Presibo was solve this problem of continuous healthcare, preventive medicine, and chronic disease management, and also creating a platform where Nigerians can store, retrieve, and share their patients' medical history digitally on the cloud. So that's why I was inspired to create this platform that would help prevent chronic diseases, that will help the over 11 million Nigerians suffering from diabetes and over 20.5 million Nigerians suffering from high blood pressure to connect to healthcare professionals across the country and also prevent and manage these chronic diseases from their homes with the touch of a button. So the healthcare challenges in Nigeria are basically infrastructure based, also access to healthcare personnel, and also access to hospitals, availability of drugs and medical professionals across the country. So how do we address this problem? We are addressing it by one, providing the infrastructure, digital infrastructure for patients and users of the platform to get access to medical professionals across the country, and also to help network hospitals across each other using the Presibo cloud, and also provide a software that will allow doctors and medical professionals to store, retrieve, share, and digitally access medical records of patients. That way, doctors can quickly and easily treat and access medical files, medical history of their patients, and it will help them, access these information and also treat better. Because there's a problem of accessibility in Nigeria. We use files, paper, but the world has moved on beyond paper. We're trying to digitize healthcare by creating access to these medical facilities, create access to medical history, and also help patients get across to these doctors by a click of a button. So Presibo is providing the infrastructure to help medical professionals access their patients and also helping patients access doctors on the Presibo application. In Africa, we have a lot of health tech startups coming up, and Presibo has a unique value proposition. We are focusing on chronic disease management. We're focusing on remote monitoring. We're focusing on preventive healthcare. We're focusing also on disease management and prevention. The reason why we're doing this is because we believe that for patients to live, for our users to live, to have high quality of life, that they need to have access to the best medical facilities, have access to doctors, have access to medical professionals. So what sets us apart is one, we're integrating artificial intelligence in our diagnosis. We're integrating our connectivity. We're also trying to make it easy for patients to access these doctors as quick as possible. And we are using AI algorithms to make this happen. I'm also introducing AI-assisted diagnostics to help patients to diagnose simple ailments with even far away from hospitals, And we're also helping people to monitor their blood pressure, monitor their blood sugar from their homes, on their phones, on their computers, on their tabs, on their laptops, whatever device they're using. They can monitor, they can get configured, personalized alerts, just like you receive alerts when your WhatsApp beeps. You get alerts when your blood pressure is at an alarming level. You get alerts when your blood sugar is at an alarming level. You get a text message, you get an email, you get a call, and your medical doctor, the medical facility, the medical professional handling your case gets that alert too. So these personalized alerts serve as one purpose of preventing ailments. Like if you're not yet sick, it helps to tell you that, look, this lifestyle, this diet, if you don't take care, it's going to lead to high blood pressure, it's going to lead to diabetes. That's prevention. Okay, if you're already suffering from that ailment, we're going to create a system where it helps you manage it at a level that is not dangerous, at a level where you can live healthy and live fulfilling life. So that's what Presibo does, and that's what sets us apart. The people who will benefit from Presibo are one, patients, users. We have those who are suffering from chronic diseases like high blood pressure and diabetes. those who are not. Those who are suffering from these ailments use Presibo to monitor their health, monitor their blood pressure, monitor their blood sugar, and manage it, using our AI tools, our personalized alerts, and get access to medical facilities, get remote monitoring. Those who are not suffering from these ailments can prevent it by using our tools to live a healthy lifestyle, to plan their diet, and to have an AI companion that helps them live healthy and better lives. Exercise regime, diets, prescriptions, what to do, how to live a life, how to eat, drink water, how to, when to sleep, how many hours of sleep you need to have a day, stuff like that. Basic things that will help you live healthy lives. And also, medical doctors, medical professionals, hospitals have a platform through which they can access their patients, through which they can get access to their patients from remotely, through they can even monitor their patients who have chronic diseases, and also hospitals, who need a platform where they can store and retrieve patient data digitally. So we are trying to digitalize medical records so that patients can easily and doctors can easily access their patient records online. Talk about your prescriptions, talk about when you visited the hospital, talk about the drugs you took, talk about your tests, talk about your scans, talk about your admissions, your clinical notes, every form of medical record that we have in paper, we want to digitize it with Presibo to help, have access, so that people can travel from Lagos to Kaduna, and then when you get to Kaduna, you don't start doing diagnosis from the beginning. You just pull up your data from the Presibo cloud, and your doctor in Kaduna can find out what the doctor in Lagos treated and understand those medical records. So we are trying to help both patients, medical facilities, those who have disease and those who want to prevent disease, have access to these tools and benefits, from this holistic package. That's what Presibo does, and that is what we are saying. Like, Presibo is not just for those who are sick, but those who are not sick can also use Presibo to prevent disease, and also those who are managing sick people use the platform to manage their patients. Thank you. Okay, about how the Presibo remote monitoring works. It's simple. We have the, the machine that checks blood pressure, and so what we do is to digitize this facility, this machine. We convert it to make it send digital information across our server, and then we from the back end can see it, and we transmit this information from the testing device at home, into the digitalize it, and then it sends it across the server and to the hospital. So the doctor sees it, the nurse sees it, whoever is managing this patient sees it, and the patient also sees it on his phone. So it, as a digital transmission, it transmits from the device that tests the blood pressure monitor, the blood sugar testing device. It transmits digital information from that testing device across the server to the hospital, and also across from the server to the phone, because it's going to be synchronized. You synchronize the tool, the monitor, the blood pressure test, the blood sugar test, the person's phone, and across the hospital. So that way, it seamlessly transmits information, and both the patient and the medical facility and the medical professional sees this information and acts on it accordingly. And the AI can also find this information and use it to warn, hello, Jerry, your blood pressure is at this point is alarming. You start hearing it in your phone, like you start seeing the beep, you start seeing the beep, you start hearing the beep, you start hearing the sound, something is wrong, your blood pressure is too high, you have to do something about it, and stuff like that. So that way, you give early warning signals, to prevent heart attack, to prevent collapsing, to prevent fainting, to prevent loss of life. Technology plays a very, very big role in our solution. We are a health tech company. We are a health tech startup, health and technology. So we're integrating healthcare and technology. Presibo is not trying to replace hospitals. We're trying to make hospitals function better. We're trying to create access. So we're using technology to bridge that gap for those who don't have access, for underserved communities, people who cannot afford a doctor, who cannot afford to go to a hospital, who are very far from a medical facility. By subscribing to our platform, they can, the technology, it's like a bridge. We are harnessing the capacity and the skills of doctors, and we're using technology to bring it to the masses, bring it to everybody. So people who cannot go to the hospitals can get this digitalized version of medical doctors, real professionals in their field, on your phone, on your tablet, So technology plays a very, very big role, from AI to big data, from cloud data for storage of patient data, from machine learning to understanding patient issues and health records and reading it and making sense out of it. So we use this technology to actually solve a problem of healthcare, which is very important in Africa, to save lives, to make our people live longer, and also to prevent diseases. The team behind Presibo, Jerry Nwobodo, co-founder, CEO, my chief medical officer, Dr. Eni Aikodon, I'm also co-founder. She's a medical doctor, and also my chief operations officer, Dr. Titi. She's also grounded in public health administration, and also another co-founder, Dr. Asuko Epeyong, is also passionate about digital healthcare, about telemedicine. So together we come together, three medical doctors and I, a software engineer, to create this platform. Together we contribute to our skills in technology, in healthcare, in public health management, coming together to create this platform that will solve this problem of accessibility to healthcare in Africa. And I believe I have got the best team. Dr. Eni has been very, very supportive. She's wonderful. Dr. Titi and Dr. Asuko, they are amazing people. And together we try to solve this problem, make accessibility of healthcare something that Africans can afford, make accessibility of healthcare, bring it to everybody, so everyone can get access to a doctor at the go, make Africans live longer, better, and more fulfilled lives. One challenge we have in Africa is affordability of healthcare, because most of our medical doctors and our medical professionals leave the continent, leave the country in droves after getting their medical degrees and all that. So it's very affordable because we are considering the underserved communities who can afford healthcare and who are not covered by the national health insurance or HMOs and all that. So it's we have a very, very affordable package starting at 10,000 naira per month, and we also have a weekly package of 3,000 naira per week, and a daily package of a 500 naira contributory subscription per day. That way, even those who cannot afford 10,000 a month can at least afford 500 naira a day to contribute to their wallets, so that anytime they have an emergency health crisis, they can always rush to any Presibo affiliated facility around them to get treatments and without being charged. That way we are trying to bring healthcare to everybody through our platform. We're making it affordable, making it very, 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 very convenient and very modifiable, so that people can actually modify it as it suits their pockets. So those who can't afford 10,000 naira can afford at least 3,000 a week. Those who can't can afford at least 500 naira per day, just to contribute in it, so that it covers for their healthcare per month. So it's that's how the Presibo subscription package works. In the next 5 years, my vision for Presibo, it's the hub for healthcare in Africa. In the next 5 years, we're targeting to reach about 50 million Africans, 20 million people in Nigeria, and 50 million across Africa, giving 50 million Africans access to good quality healthcare, preventing 50 million people from getting chronic diseases, helping them manage it, and also being the authority when it comes to digital storage of patient data and patient information. So we are looking at creating a platform that will be very affordable, that will make healthcare affordable for all, that will make healthcare accessible for all, not beyond the reach of the common man.